All right, fine. So, sir, we'll just see what all changes you have happened. We'll just, record this call for a very short period of time.
Yeah,
Okay.
no, no problem
पाँच
at all.
5 मिनट का recording करेंगे हम लोग. In this, what I want from you is that I want you to introduce yourself. I'll ask a few questions, okay, and you can answer those questions to be the point, be to the point, and we'll keep this recording so that a lot of people who are of your age, especially who are having different kinds of diseases, also they will get a hope of what is possible. All right.
Definitely. Yeah.
एंड इट इज लाइक कि मतलब ऐसा नहीं कि 1-2 महीना किया हुआ है, आपने 6 महीना किया हुआ है. ठीक है, तो probably you are the right person who can talk comprehensively about what all changes you have seen in last 6 months, and what are the possibilities that you can talk about. So first thing which I would like to know from you, sir, is your introduction. What do you do? Where do you work? Can you just brief us a little bit about that?
Yeah. See, my name is Dr. K.F. Wazifdar. I'm a gastroenterologist working in Holy Family Hospital, Mumbai, and I also work in the Ramakrishna Mission Hospital, Mumbai. In February of this month, coming February 8th, I will be now 60 years old.
Congratulations, sir, into the
Thank you.
senior
Thank you.
citizen field.
But to be very honest, uh, 6 months that I have taken with you have made a big difference to me. It has taught me a couple of things. First of all, most important thing is what I was trying for years and years to actually have a decent diet. I have finally achieved that. And it has taught me also that even, suppose I do break my diet, I can manage to do some intermittent fasting and long term fasting next day and prevent any kind of increase in my weight. Besides that, the diet that you've given me uh, has helped to reduce my sugars to practically normal. Now I don't need to take a anti-diabetic tablet. See, I've had a bypass done 2 years ago.
So we'll talk
Following,
about that, sir.
yes,
I actually
okay,
wanted to focus. I wanted to put it as a separate question itself. So
fine.
first, sir, can you tell us about your weight? How much was your weight?
So when I started with you, it was 124.8.
And what was your height, sir?
Well, my height is 5 foot 11 inches.
All right. So it's almost like 35 kgs more. Okay.
Yes, it
And
was.
since how many years you had been in this overweight category?
I have been above. I think for the last 20 years, I have been having this weight.
Got it. And
So almost like my body had got used to the weight. And when you have weighed so much for such a long time, the body does adapt to that weight. Very difficult to get that weight down and then to maintain it, which
100%.
somehow I have achieved.
100%. And
So
you tell us more also about the I want you to answer the two questions, sir. What all problems apart from overweight you were suffering from? Okay. What all surgeries probably you have undergone, and what all medications you had been taking before we started the program.
see, overweight. The one of the main problems was sleep apnea. Now, if I was using a CPAP machine for uh, almost the last 2.5, 3 years. And since the last 1 month, slightly over a month, I stopped using the machine and I'm able to get sleep. So, what I feel is that since you have always stressed that sleep is a very integral part of this, not only weight loss, of a healthy lifestyle, I probably will use the machine once every 3 days or something. But
Correct.
otherwise, I'm getting adequate sleep without the machine also, which is something I could never get before.
Got
So
it.
that has been something very positive. Number two is definitely with a little bit of weight loss and healthy lifestyle, my stamina has improved.
That is, sir,
My
changes which you have seen now. But what
ah,
problems you were suffering from? One was obstructive
ah,
sleep apnea. Okay, OSA.
obstructive sleep
Ah.
apnea. Secondly is um, hypertension I had.
Since how many years, sir?
Hypertension is more than 25, 30 years.
Got
And
it.
I was intermittently on tablets. Now, of course, the hypertensive tablets have come down a lot.
We'll talk
Uh,
about that, sir. और
yeah,
डायबिटीज भी था मुझे लगता है आपको. You had diabetes also.
diabetes, yes. I had suffered from a little COVID myocarditis also. and dilated cardiomyopathy, and I had to get operated for that.
Correct.
So post surgery, I had bypass surgery, and post surgery I had diabetes. So the diabetes has now disappeared, in the sense the HbA1c, which was on something like 6.8, now has come down to 5.4.
Amazing. Amazing.
Basic. The uric acid has come down. I was taking xyluric tablets regularly. I have stopped. I've almost made it once a day, from 2 to 3 times a day. Uric acid has come down. Cholesterol has come down. I'm taking atorvastatin alternate days.
And
I'm still
previously, what was the
maintaining
dose,
it.
sir? अठारह का कितना dose था
40
पहले?
milli. I started with 40 milligrams a day. Now I'm
Okay.
taking 10 milligrams alternate day.
And can you elaborate, sir, on when you were on 40 milligrams of atorvastatin, what challenges you are facing because of that statin?
See, even now I'm having, the challenges I'm facing is I don't have any liver abnormalities. I've done my blood checkup, but I'm definitely having a lot of muscle cramps.
Even today, sir.
Yeah, even today, especially when I get up in the morning, no, until I walk and till I warm up a little, the cramps do remain.
Got it.
But once it takes about 3 or 4 minutes of doing soleus push-ups, that moving the leg up and down, the and walking a little, that relieves the cramps. Otherwise, getting up from bed gives me a little muscle cramps. Even today,
But you started at 40 mg. What is your
yes,
current dose? Now you're talking alternate days. Is it
10
40 mg
mg,
alternate day or is it how much?
10 mg alternate day,
10 mg alternate day.
10 mg alternate day.
Have you seen a change in your myalgia when you have shifted from 40 mg daily to 10 mg alternate days?
There's been a mild shift, but I am aiming to stop the statins. And once I stop the statins, things are definitely going to improve. But
Correct.
right now, I'm not very confident stopping statins now. So, because even though the cholesterol is normal, I want to continue alternate days. I'll make it once in 3 days, and then I'll decide what to do with it.
Absolutely. That's the way to go, sir. And you always keep your LDL levels below 100.
Yes.
Okay. Okay. That is very, very important. Okay. If you keep LDL below 100, then, even the cardiologist is happy then. All right. So good. So you had undergone bypass, you had hypertension for many years, you had diabetes also. Okay. On treatment. Let me just change the network. I think there is some network issue. Let me just change the network. Yes. All right. Fine. So, sir, you had overweight issue, you had hypertension, you had diabetes, you had viral myocarditis because of which you underwent bypass surgery, and you were on medications for how many medications you were on for hypertension, sir?
I was on two medications.
Currently, how many medications you are taking for hypertension?
Now I'm on only on one medication for hypertension, and I take two medications to because my ejection fraction was low. See, when I started off, it was 30%. Little before that, it was 30%. Now it has increased to 40%, both with medication and with weight loss.
Got it. That is significant increase, sir. For 10%
Yes,
increase is very good increase actually. Okay.
40% is compatible with comfortable life.
Yes. Yes. Very much.
Yes.
All right. So good. So
Only thing I will tell you, unfortunately, because of time constraints, as you know, in our profession, exercise has been a issue. And I always wanted to do some amount of weight training because it helps in to prevent sarcopenia, muscle loss, and also it prevents in weight loss also. So recently I have started a little dumbbells, and I use that mudgal, the way you twist around the head like this.
वो वाला हाँ yes
So I'm
yes
using
yes
it also.
बहुत
Uh,
बढ़िया.
so these two things I started, and I'm slowly starting. I don't have to put pressure on my heart. Obviously now with 40%, I don't think there'll be too much pressure now. So slowly I'm starting.
Very good.
I
So,
think
sir, so you got started, about 6 months back. All right. जब चालू किया था प्रोग्राम सर, तो आप कैसे थे? मतलब स्केप्टिकल थे या सुपर कॉन्फिडेंट? हाँ, मैं तो अभी तो गाड़ दूंगा, मैं तो
no,
100%. How
no.
was
I
it?
will tell you, when we had a discussion prior to starting the program, and when I was talking to a qualified medical person, So then I had a little confidence that this time something is going to happen, something positive will come out. Though, see, I have never been very confident, not because I have not been able to keep up to any diets up so far.
Correct.
Neither have I been very consistent with my exercise.
Correct.
But this time, talking to you, I had a little confidence that, yeah, this time maybe we may be able to achieve something. And I
Correct.
told you, I had even gone on semi-glutide.
Yes, yes, semi-glutide.
Now,
Correct.
that semi-glutide had helped me lose a little weight. But because of the side effects, since the last, as you are aware, 5 months, I'm off the drug because
Yes.
I'm unable to take it.
Correct.
Though I think semi-glutide is a very good drug for weight loss.
Hmm.
If and together with the program that you are having, the additive effect of the drug will definitely be there. By itself, I don't think you can lose too much weight with it, but
Hmm.
with the diet program and the healthy lifestyle program that you have, weight loss will definitely be there. But I could not do it, unfortunately, because of the side effects. If I could do it, I'm sure I would have lost at least another additional 4 to 5 kilos by now.
It's still
And
possible, sir.
I don't want to go on back to that drug.
Absolutely, sir. With those side effects, you definitely, and again, it is still an unnatural thing because, ultimately a drug is a drug. Okay.
Yes,
You
yes.
got to get off medications.
And
That's
then you, once you start the drug, if you stop it, you'll have a rebound weight gain.
exactly.
So then it has to be continued lifelong. And there are a lot of toxic complications people are not aware of. Pancreatitis, thyroid carcinoma. You can't take the risk. It's better to be overweight rather than get cancer and all. So, and diet, if, we have lost weight and having a healthy lifestyle with just dietary modification.
Correct.
So I suppose,
Very good. So, sir, in last 6 months, can you just tell what all changes you have seen? You talked about blood pressure medications. You have shifted from two
yeah.
medications to one
So
medication.
blood pressure medications have come down. Diabetes almost gone. Sleep apnea has improved a lot. Stamina has improved a little. And of course, everybody keeps telling me that, oh, you lost a lot of weight. You're looking much more fit. That's it.
तो आपका ड्रेस का साइज पहले कितना था और अभी कितना है?
Now, I have not changed any dress, but first it was 50.
Hmm.
Now 47 fits me.
47 fits you.
3 to 4 inches have gone. See, I
Very
used to wear
good.
suspenders. I was one of the very few doctors who used to wear those suspenders.
Yes, yes.
Now I am wearing suspenders, but I have to wear a belt because now the suspenders can't hold up the pant. It looks very funny because
Exactly.
so I have to wear a belt and a suspender. Previously, I didn't need a belt; suspender was enough. Now I have to wear a belt to hold my pant up. All my pants have become loose. My shirts may not have become so loose, but from the waist, I have definitely. It's very obvious that they can see that my pants are very loose. I mean, uh, maybe
Wonderful.
in another 3 months, I will go for a wardrobe change. I'm just holding on till I lose a little more weight. Right now, I am still 114. I've kept and maintained that weight. I
So 10
hope
kg weight
to.
loss.
Haji?
10 kg weight loss.
Yeah, almost 9 to 10 kg weight loss. So in another month or two, I hope, because I've changed my exercise program I've created, I've changed my diet in the sense I'm still eating the same thing, but I've reduced the portion size. I still have, the problem is uh, my breakfast is the main problem. You see,
I know.
my lunch and dinner are well controlled with salad and dal. So that is not a problem. Problem is my breakfast.
I
And
know.
problem is that I'm not getting a good breakfast in the hospital. So as you have said, I have tried my best not to eat bread. But sometimes I have no choice. Once my breakfast is taken care of, somehow I'm trying to work on that. I'm trying to work on that. I think then things will definitely, and I'm trying to
And
increase my.
also your shifting thing and all that also,
Ah,
it
that
was
has
sort
upset
of,
the whole thing.
so,
Yes, yes. Last 3 months have gone in that only.
correct.
I'm increasing my fasting interval. See, today also I eaten only at 7:30. I finished my diet, and tomorrow I'll try to eat by 11 o'clock. So I will have a decent fasting interval.
100%, sir. So one
So
last
I'm
question.
doing that.
One last question, sir. Whatever you have done, the changes which you have done, okay, in last 6 months, okay, the remarkable results that you have got in terms of reduction of the BP medications, diabetic medications getting stopped, almost reversal of diabetes, then your ejection fraction increased to 40%, 10 kg weight loss, inch losses, and increasing your energy and all that. Starting your strength training, okay, which was a difficult task for you earlier. So all these changes, okay, which has happened, and what are lifestyle changes which you have done, okay, in last 6 months? Do you think that you can sustain this lifelong? Can you follow this lifelong?
Yeah, see, that is exactly my aim to. So what I'm doing is that the two important things that I am maintaining right now is the salad. Okay, so I can follow it lifelong, and there are certain hacks that I have developed myself. Number one is I have a salad. I both afternoon and uh,
Dinner.
dinner, and I'm trying to increase my protein intake also,
Correct.
and I'm very slowly increasing my fasting interval to such a time that I want to have only about 2 meals a
Two
day.
meals a day.
Means I'm trying to avoid dinner or just have some soup or the Amway protein powder for dinner. So
Correct.
once I do that, I'm going to cut a lot of calories there. So uh, that is what I'm trying to do. If I can keep to 2 meals a day by and increase my fasting interval, then even if I have cheat days, if I have one or two cheat days also, I can make up by increasing my fasting interval or appropriately fasting on the next day, which is possible. See, if I have to maintain this diet, no, then I have realized one thing: I have to eat what I like also. Otherwise,
Correct.
it is
Absolutely,
difficult to
sir.
maintain the diet.
Absolutely, sir.
And if I eat what I like, then I have to have the willpower to have a good fast the next day, because unnecessary calories you have to compensate. So that is something I'm slowly doing, and
Correct.
I'm getting used to it. And I don't mind doing that, because if I eat what I like, I don't mind having something less. So Sunday, uh, 3/4 of Sunday, I only had lime juice the whole day, and then I had dinner only in the night. I tried it out, and
Okay.
now next time I'm going to try out only having chas whole day and one little salad for dinner in the night. If I can sustain that, then I know that I can sustain a fast with comfortably. So I can, break I have a cheat day whenever I go out or something, eat properly, and then make up in the next couple of days. If I do that, I think then I'm going to have a steady weight
Correct.
for the next many years.
100%, sir. And I would really appreciate that, the kind of changes which you have done. If I see your meal plates in the beginning, तो और आज का जो मील प्लेट्स है ठीक है there's a huge difference which you have done
Mm.
and I still remember that we had so many interactions that change this again and again, again and again, again and again. And then,
Yes.
you eventually came up with this now. So just for the information of everybody is that sir has a particular way of eating and sir has a particular way of following his protocol. He has developed his own protocol. And this is not a blanket protocol for everybody. So this is just for sir, which he has customized himself for himself, okay, through our plan. And this is suiting sir very nicely. Okay.
And
This,
I followed a lot of things like I stopped paneer and all that, because despite high protein and a lot of fat. So now
hmm,
what I do is I can make cottage cheese, and I just take milk, put in a little bit of lime
hmm,
juice,
hmm,
tear the milk, and I
hmm.
can make cottage cheese from that. Just you squeeze it in that special strainer that you have, and you
Right.
have your own cottage cheese. Fatak se.
Yes.
So
Yes. Yes.
and that has low fat and very nice, because if you take skim milk, you can have low fat cottage cheese. So that also I'm doing, trying that also out. But at the same time, I'm eating occasionally good food also, so that I can sustain all this. Otherwise, it's
100%.
very difficult to sustain.
Otherwise, it is difficult. Great,
Difficult.
sir. Sir, one last, any last message for people who might be seeing your video, especially those who are, 50 plus, okay, and busy with their
Huh.
practices. So, any
So
message for
what
them?
is important, as you have always said, and now which I'm uh, believe in, is that a healthy lifestyle, healthy food is important. Weight loss is just will be a byproduct of that. So having uh, and sticking to a particular diet, most important even today, is charting. Means I write on I carry a small diary with me in
Hmm.
my
Hmm.
pouch.
Hmm.
So I write down whatever I eat, and at the end, in the healthy ones, I make a calorie count and a protein count.
Hmm.
I'm not able to achieve my optimal protein even today, but it's always less than optimal. But calorie count I'm able to achieve. So I what I say is that you should chart what you eat. You should calculate your calories. You should make sure that you have adequate proteins and include a lot of salads, at least lunch, at least some amount of salads both in lunch and dinner, because that fills you up, and then you can have something else after that. And as you have always told me, which I'm trying, omit rice, bread, carbohydrates. Potatoes is fine, sweet potato is fine, but carbohydrates we should have a little less. And that's it.
Wonderful, sir. You have done amazing. Okay, and I always feel that yes, you can still do better. I think still there is a scope of at least 10 kgs more weight loss. And if you do that,
So I'll
you
keep
know,
you informed every month. I intend to lose at least two kilos every month, not too much. 2 kilos every month I intend to lose. So another 6 months I should lose about 10 kilos more. So
100%,
that will make me at least about say 104. And I
100%.
think 100 should be enough now. And for me, and then I should maintain that weight. That's it. Not go for any more reduction. Once I reach, if I reach 100, that is 24 kilos less. I think that should be good enough.
Absolutely, sir.
Because at the age of 60, losing weight is difficult.
Exactly.
Maintaining it may not be difficult. Losing weight is difficult. Metabolism is not as fast as you're young.
Exactly.
A younger person can easily lose. They have this yo-yo, lose, gain, lose, gain. We can't do that. At my age, losing is very difficult because after some time you reach a plateau and so many things are there. And then when you reach a plateau, as you have told me, I have to increase my fasting interval. I have to take more protein. So I have to keep paying attention to all that. So I feel that if I'm reaching a plateau, the best thing is fasting, because doing everything else, because is not going to help much. I think the only thing that helps, and I've gone through a lot of literature also, autophagy and fasting is probably the one of the best things.
Absolutely,
I
sir.
had gone through a little, the Japanese fellow who won the Nobel Prize for autophagy. I forgot his name. I've gone through his articles on the net, and he makes a lot of sense.
100%, sir.
So I think that is the only way out. The only way out. And
Great,
diet,
sir.
losing weight by exercise is not going to happen. Even I know that. So only way I've lost weight is because of diet, and that is the only way I'm going to lose weight is diet and fasting. That's it.
बहुत बढ़िया sir. Thank you very much for
Mm.
having a short interview with you, and I'm sure this interview is going to inspire a lot of people, particularly those who are having multiple health issues, and also for those who are actually in 50 plus category. Okay, so great. We'll
Definitely, because one thing I realized: reversal of diabetes, hypertension, is comes with a healthy diet. I've
absolutely,
learned this, and
absolutely.
increasing your fasting interval, which I'm
बिल्कुल
doing
sir,
now. That's
बिल्कुल.
it. And we'll keep
What
in
sir?
touch because I have to give you my follow up
Yes
regularly.
sir. Yes, sir,
Uh, uh,
100%, 100%. But we'll stop the recording here at this point of time.
yes,
Okay,
definitely.
and then we'll talk. Yeah.